By looking out for all the workers, we make sure that everybody gets lifted up instead of everybody fighting for the crumbs, which is what we were at before. I had a sociology teacher, and I made a paper that was, I called it taxation without representation, and it was and I started researching. So I'm like, no, undocumented immigrants. And this was a while back. Undocumented immigrants pay taxes, and people were saying, no, no, they don't. And then I did the research and I showed it, and I said, you see, and it's a whole community of workers that they figure out ways to work.
Yeah.
So then they end up paying taxes.
Yes.
And they get very little services back.
I support Medicare for all because we do have to figure out how to find other ways for workers who are working. And I always remember people who are working but do not have health insurance through their employer to be able to qualify for health insurance coverage. And in other countries in the world, health care is a human right. It's provided by universal health care. So we are not doing anything that the rest of the world doesn't do, which is to make sure that every person who lives in this country is actually have access to preventive health care, not just emergency care that leads to bankruptcy for many workers.
Hi, everyone. My name is Bautista, and welcome back to the Change Podcast. Today, we have a special guest, my friend, Dr. Patricia Campos-Medina. How are you, Patricia?
Very well. Thank you for inviting me, Ron.
Yeah, no, thank you so much for making the time. I know you're a U.S. Senate candidate for New Jersey, and I know you're going all across the state. I can't even imagine how much work it takes to go across New Jersey. I guess we don't really realize how big New Jersey is until we have to go through it, right?
Yes, exactly. Imagine one time I began in Passaic, had to go all the way to Vineland and then come back to New Brunswick. And I was like, oh my God, this is a long trip.
And now you're here in Jersey City.
And I'm here in Jersey City.
For this podcast, and I'm very thankful. I'm very passionate about your campaign. I love what you stand for. We've known each other for a few years, a bunch of years.
A bunch of years, yes.
Yeah.
You were right out of college, I think.
Yeah, I was, and you know,
And we met in Jersey City.
we met in Jersey City.
Race.
Yes, a local race, and I've been always following your path, your work with the labor movement for workers' rights. Can we start there? Where did your passion come from in terms of being involved with rights for workers, for everyday workers?
So, where my passion for workers' rights, they come from my experience being the daughter of low-wage workers. My mother was a hotel housekeeper. She cleaned homes. She made pupusas. We're from El Salvador. She took him to the soccer games in the weekends. My father was a jornalero. He a construction worker. He worked in cleaning offices. So what every immigrant does to survive when they come from their home countries. And I felt that in the richest country in the world, how could people work so hard and still have so little? They didn't have health insurance. They had to go to work even when they were sick because if they didn't go to work, we couldn't pay the rent. But because of their sacrifice, we always had, we were never house insecure. We always had an apartment. We always had food. We always had other relatives around, in and out. So los tíos y las tías nos estaban cuidando siempre. So I always felt safe and I always felt protected and provided for. But I always felt that the level of sacrifices that they were paying in the richest country in the world. And sometimes, they would get sick and they didn't have any help. They wouldn't get paid. Sometimes wage theft is a reality for immigrants. And I felt like how unjust that is. This is a country of laws, of rights. So as an immigrant myself, I came to this country at 14 years old after being separated from my parents for about 8 years. And being left in El Salvador, and you expect things to be so much better when you get to the United States, and then you find out that, oh my goodness, it's still hard. It's a hard life. So I wanted to be an advocate for the rights of my parents. I wanted to learn about labor law. I wanted to be a labor attorney. And I learned about the civil rights movement and about government and about the history of this country and how immigrants, African Americans, and workers always had to struggle for their rights. And that was my passion. I applied to go to Cornell University at the School of Industrial and Labor Relations, thinking that I was going to become a labor attorney. And unbeknownst to me at that time, I actually became a union advocate and a union organizer.
That's beautiful, and I already see so many connections and similarities. I actually came at 12 years old from Ecuador, and my parents were and I were undocumented. They had to work in cleaning service, so
Yeah.
they clean homes in Hoboken. When my dad got sick at ALS, I had to step up and work with my mom,
Exactly.
help out, and be able to, clean homes of 30 families across Hoboken. We only focused in Hoboken, but if we don't know our rights, like, I was fortunate that I had certain guidance and I got to meet the right people that then I got to understand how to negotiate my the prices and be able to pay for my college tuition, which was actually Hudson County Community College, New Jersey City University. I was able to pay out of pocket, but also because the prices were not rising in those
Yes.
universities.
Yeah.
And then, really seeing through sharing that similar stories is not just an immigrant story, it's an everyday person
Yeah,
story of
exactly.
we all struggle, we have to find the means to do the job. Then when they're not frameworks to protect workers and workers' wages, right? We've come across. I mean, you were part of the fight for $15 minimum
Yes.
wage in New
Yeah.
Jersey, and before that, the conversation was, why are you complaining? You are doing this small job. That's what they would
Yeah.
say. And you getting $7 an hour, you should be thankful you're even working. I actually got that comment one time when I was, applying for the 4-year college. They told me you should even be thankful just that you're able to get an education. I said, I'm paying the tuition myself out of
Exactly.
pocket.
Exactly.
Um, Tell us what was your involvement with $15 minimum wage in New Jersey and how that advocacy came about?
I fundamentally believe, right, that workers need to know their rights. So education is important, and labor unions play a big role in the education and fighting for the rights of all workers, not just our members. So when I arrived to New Jersey in 2004, I was already a union representative. I was representing hotel and restaurant workers, and we were actually trying to get the hotels here in Jersey City and in Hoboken, the W.
Yeah.
We were trying to make it a union hotel. That's how I came to New Jersey, and during those conversations, it was just amazing to me how little people were earning right here in New Jersey, which is such a expensive state to live.
Yeah.
And to be working at a hotel, right across, from New York City, and in New York City, most big hotels have unions. So you work there, you're making $25 an hour, $30 an hour, and you just cross over the river, and people were making minimum wage. It was it's just unacceptable. And I think that we as citizens need to start saying some things are just unacceptable. And that's why I joined the New Jersey Working Families organization at that point. And we started to see that there was a trend. Most low-wage workers are Black, are immigrants, are Latinos, and they work where they live, right? So if we don't make those jobs better jobs, then we are still creating this cycle of poverty. So that's when there was a national movement at that point to get the fight for 15, 15 making it the base. That was back. Oh my God, that was back at the
5 years
beginning.
ago?
Yeah,
Was it 5 years or
no,
more?
that was at the beginning of the 2000.
Oh my gosh.
Yeah, and remember how it started? It started.
Oh, I meant to say, when did we get it in New Jersey?
Oh, we got it. We got it about 10 years ago.
10 years
Yeah,
ago.
yeah,
Yeah,
yes,
yeah, yeah.
yes.
And we started getting it little by little,
Little
right?
by little, yes.
Hmm.
So it was a coalition of unions community organizations, and we said we have to join New York because New York had the same campaign, the 5 for 15, and we began the 5 for 15 in New Jersey. And many businesses, I mean, the business community always says, oh, you raise the minimum wage, businesses are going to go away. And we always said, if you raise the minimum wage, you immediately put money into everyday people's pockets.
Yeah.
And working people, if you get more money, you spend that into your own community. You're able to get, buy things for your home, perhaps go out one more day with your kids for dinner. You don't put it in your pocket and put it on Wall Street, right? You put it back on the street. So you create more economic activity for businesses. So no business has left New Jersey because of increasing the minimum wage to 15. That's just what I'm going to end up saying.
Yeah, no, I think it goes back also to our immigrant communities, which is many people think by having immigrants come into this country that's a detriment, when even the Congressional Budget Office says actually that activates the economy, that makes more wealth creation for everyone.
Yes.
Because the reality is when immigrant families come, they have to figure out how they're going to make ends meet. So they're going to work, they're going to earn wages, they're going to invest, they're going to put money in the towns that they live in,
Yeah.
in their economy. So, and also by looking out for all the workers, we make sure that everybody gets lifted up instead of everybody fighting for the crumbs, which is what we were at before as well.
The New Jersey Policy Institute just put out a report this week about the economic impact that the immigrant community, undocumented community has in New Jersey. And it's in the billions in terms of the generating economic activity and putting back money into the economy. Remember, we have our economy, we have an aging workforce, and we have a population of elder members in our community who are living longer. So they need more workers in the care economy, either nurses, have a shortage of nurses, home workers, people who clean, help middle-class families keep their homes going. So all those are immigrants, and immigrants are young. So they come at the prime age of their performance. Like you came, as a teenager. I did too. A lot of immigrants come in their early years, and they put money into the economy. They keep Social Security strong.
Yeah.
They keep our unemployment insurance strong.
Yeah.
And many times they don't even receive those benefits.
Back in, sorry to interrupt, back in Hudson County Community College, I had a sociology teacher, and I made a paper I called it Taxation Without Representation. And it was and I started researching, and I'm like, no, undocumented immigrants, and this was a while back, undocumented immigrants pay taxes. Yes. And people were saying, no, they don't. And then I did the research, and I showed it, and I said, you see? And it's whole community of workers that they figure out ways to work.
Yeah.
So then they end up paying taxes.
Yes.
And they get very little services back. It's not just sales taxes. We figure out some politicians, they're like, but how could they work? I'm like, we figure it out.
Yeah.
We figure it out, and we pay our share. Because we're looking for that advancement. So it's about thinking. Imagine what more of those immigrant communities can do if we're able to give them more opportunities so they can grow. Exactly. That means the economy grows. That means more taxes so that we can have tuition-free college, so that we can have all these other initiatives that we're going to talk more about today.
Exactly. So in terms of the immigrant workforce, it's integral to the economic vitality of New Jersey and this country. And we need to, and like you said, they have a 85% workforce participation. That means that they're always working. And that's a myth that we have to take away from the MAGA Republicans.
Yes.
That immigrants, take all the benefits away. Now, there are things that we need to provide if they're working for, like healthcare, right? Mm-hmm. If you do not have permanent employment, what we have in the United States, that health insurance is tied to your job, and many jobs do not offer health insurance. So a lot of our population do falls into that category, and that's why we do have to figure out how to create more opportunities for healthcare coverage for working age adults who perhaps do not receive it from their employer and do not qualify for Obamacare. And so they don't land on the donut hole or they end up with no health care, which leads to other complications. And that's why I support Medicare for All, because we do have to figure out how to find other ways for workers who are working. Now, always remember people who are working but do not have health insurance through their employer to be able to qualify for health insurance coverage. And in other countries in the world, healthcare is a human right. It's provided by universal healthcare. So we are not doing anything that the rest of the world doesn't do, which is to make sure that every person who lives in this country is actually have access to preventive healthcare, not just emergency care that leads to bankruptcy for many workers.
Patricia, you don't know how refreshing it is for a candidate for U.S. Senate in New Jersey to be able to say clearly, I'm for Medicare for all, and healthcare should be a human right, not just on paper, but on actuality, which is an actual policy that we're not reinventing the wheel. It's something that the majority of the developing world already does it.
Exactly.
That the developed world already does it. That we know that it works. That Medicare itself is something that is popular already
Yes.
amongst our seniors in our communities. That single payer, and also this is such low hanging fruit
It's yes.
for politicians because it doesn't matter if you're making $50,000 a year or $170,000 a year. The private health insurance sucks, and
It's
and
difficult to navigate.
not only is difficult to navigate, and yes, it's difficult to navigate. It's complicated to understand. You're getting bills left and right. I just had a daughter. She's 7 months now. I'm getting bills left and right. And I'm like, so which one is covered by insurance and which one is not? Am I supposed to pay this? Then like, and then you have different providers, and it's gotten to such a point that even now I thought because I had a really good job at one of the biggest companies in the
Exactly.
in the U.S. that my coverage would be just perfect. And then I take my daughter to the dentist that she's been going to, the dentist office that she's been going to, my 5-year-old for all her life. And now they don't take insurance, dental insurance. They say no. Now we're only getting out of pocket starting in January, and then I asked a friend of mine that was a voter in Hoboken, and he's opening up his own dental place outside of Hoboken, and he told me, I asked him, I was like, "Is this a trend?" He's like, "Yeah, because it's not fair for doctors, and doctors are not supposed to be
Yeah.
business people."
Yeah.
And so,
Yeah.
what's your vision for that to happen for us as voters in New Jersey, for us to have Medicare for all, and for us to resolve this issue?
I think we first have to continue to talk about what Medicare for all is and is not. Medicare for all is not single payer healthcare, is not universal healthcare. And we're not transforming a healthcare system. Transforming it will be to go to universal healthcare. So, but that's not what Medicare for all is. Medicare for all is just saying, let's expand the power of Medicare, which is already a program that works for seniors because has the power of negotiating prices at a bulk level with the hospitals and with drug companies, and it lowers the prices so that doctors can actually have more of a fixed price on the services that they provide. The problem that we have right now with our Medicare healthcare system is that you have private insurance, and every private healthcare is different, and they have to negotiate prices of different services or different treatments with different health insurance, and it becomes you actually cannot just be a doctor. You have to be a, a you have to have people like administrators just negotiating with your healthcare companies about what procedures you can actually give to your patients. So what Medicare for all is just expanding the ability of Medicare to cover more people who don't have access to healthcare. That is covering that donut hole that was left out from Obamacare. we like Obamacare. We've spent 10 years getting it done, and I think it has worked to provide coverage for 40 million people. We need to protect it. We need to keep it. But we also need to figure out how to cover the people that do not have any coverage. And that's about 10 million workers.
Yeah.
So if we do that, then we're able to, give more coverage to more people and actually force the prescription drugs companies to lower the prices. I do not buy this argument for prescription drug companies that you need to charge a lot of money because it takes a lot of research to develop drugs. Other parts of the world charge much less for prescriptions. And the current legislation, which would cap the insulin prices, why can't we do that for other medicine? It can be done. It's just that the drug companies have been unregulated for a long time, and they see this pro profit healthcare system as a way to make money and to increase their profits. And I think that's what we as citizens need to keep demanding. Healthcare should not be a profit making enterprise. It should be an enterprise to help people stay healthy. Change the dynamics of that. So how do we get it done? We have to demand it. We have to keep telling politicians that it's not okay to keep taking drug companies' money or pharmaceuticals' money and then go to Washington D.C. and do nothing to rein in the control of health of our healthcare costs. We also need to demand that we actually that we actually get politicians who care about this thing. We're not so afraid of the insurance lobby. The insurance lobby is very strong, and the only way we're going to change that is for people to go vote and ask politicians, will you fight for Medicare for all? Will you fight for to let my doctor actually be my doctor? I had the same experience. I am 51 years old. I'm not ashamed of saying my age. I am entering menopause, and I have all kinds of medical complications. And my gynecologist, who I had all my life through having my kids, and who has seen me through all the changes, all of a sudden my health insurance decided that they will no longer accept him. Like they put him out of network. So now, it's not his choice. It's the insurance company decided that he's out of network, and now I have to change doctors. To me, if I feel comfortable with a doctor has been taking care of me, and I trust them with my health. Me, I'm having to have 2 mammograms a year, and having other issues, and I'm being very open because these are issues that we as women, we have to worry about our own health care, but also our family's health care. And so we have to pay attention as women about, what does it mean that it's taking away our power to take care of our own health as we get older.
No, that's. Thank you for sharing that, because that's the way that we are able to see how politicians are. There's candidates are different, and they're different because of where do they get their campaign donations, and because that's who they're gonna serve, right? And also, what are their life experiences and do they relate to mine? Because if you lift it and you also are open to listening, I think change, and this is the theme of this podcast, is I think change starts with listening. When I ran for office, I made 4,000 phone calls to local constituents. I was just calling people. And the way that I would approach it, I got some training, was I started by just asking, and introducing myself and saying, I just want to hear what are some of the issues you're passionate about? What are your concerns? And then a lot of people would tell me.
Yes,
They're like, I'm very busy, and then they would have a conversation for 15 minutes.
Yeah.
And so change starts by listening, and change also starts by living through your experiences and also by relating to the experiences of others. So thank you so much for sharing. Yeah. Something that came from what you just mentioned too was how healthcare shouldn't be a business. It's more about, we cannot negotiate our health,
Yes.
right? I can't go to the doctor and be like, I'm just gonna live with this difficulty, which actually happens a lot.
It happens a lot.
And so, but that what happens is then our health gets even worse, and then eventually we can't get away from those healthcare issues. So we're not even preventing that because the first block is the fact that it's being treated as how much more like the pharmaceutical companies can charge us for our medicines, and how we don't have. Medicare for all that can help us make sure that we don't not just that we don't go bankrupt, but that we have the coverage so that way we have the confidence of going to the doctor, getting those checkups, preventing those healthcare issues. It reminds me a little bit of the housing crisis we
Yeah.
have also
Yeah.
in this country. Could you tell us a bit about that as well, about your vision in terms of how do you keep more affordability, but not just keep, but how can we expand more? I call it more nonprofit apartment units.
Hmm.
I think that's more. Just gathers a bigger coalition of people and also of ways to provide housing because what we have seen even in Jersey City and in Hoboken, some people were thinking, oh, affordability, it's people who are not making that much money, and then people who were young professionals or who were making good money, they started seeing $2,000 raise in their rents, and then they're like, wait, affordability actually goes, for everybody.
Yeah.
And so, what's your vision in terms of bringing that to the Senate? Is what do you how do you want to address the housing crisis?
Um, I was I was just in Newark yesterday, and like you said, I asked people like, "What is your biggest concern?" I want to learn from you. And Newark is also suffering an affordability crisis on rents because it's expanding. A lot of new development, a lot of new businesses coming in, and there hasn't been a pre-planned approach to how do you keep housing affordable for mixed income families, for communities that have mixed income in in their planning process. So what we are seeing in New Jersey, and I said that affordability is not just for middle class families who have homes and that they're stuck on mortgages that are high and interest. Affordability is how can I afford to live where I work? Where are the jobs and who is living there? And in every community, in cities like Jersey City and Hoboken, when you see more affluent people moving from New York City to here, you see people who live here being displaced out. And we need to do a better job of planning growth in our cities. And planning growth has to do how do we create communities that are mixed income. And there is a role to play for the federal government through HUD to encourage the creation of livable mixed income communities. There are incentives through tax breaks that the federal government and HUD can do to partner with municipalities and the state government and developers to actually put agreements in place that there will be different levels of income accessibility in any development. Now, there has to be the willingness from the local municipalities to actually force developers to accept some of the HUD restrictions, right? That is a political will. And I always said to citizens locally, like Hoboken, that is going now through a referendum on you will know better on the rent.
Is rent control and
Yeah.
also I'll get into that later. But yeah, you can
Yeah,
say
but right now, what's going on in Hoboken and
yeah.
trying to pass a resolution is part of what we need to like be more aware of and more engaged of as citizens. Because whatever a community decides, that's how uh, you go back and negotiate with HUD and the federal government and the state to help you do. If we're not engaged in those local discussions about how we're going to grow, then we leave it to the politicians and to the developers to decide what type of housing they build. So as a federal representative, I think the first thing that we need to do, and we need to demand anyone in Congress, and I think our congressional delegation need to do more of this, is to figure out how to invest in HUD so that HUD invests more in local redevelopment projects that have requirements for affordable housing for affordable housing vouchers, for rent control units, so that we can create livable communities for mixed income uh, uh, populations. Now, that requires also that we invest in public transportation, that we invest in creating jobs in those communities that are good jobs, and pay a living wage, so that you are actually creating opportunity for all. That's what I talk about affordability as creating an economy that works for everyone, not just thinking about the middle class and the upper middle class, but creating opportunity for everybody who is at the entry level of a job, and then creating a nice that way we reduce the level of poverty also, which is important in our communities right now.
And I know that there's federal grants that come down to the municipal level, the county level governments that could really be impactful and help in this way. Something that I would like to add to what you said, and that take what you can, is having funds that support right to counsel. So
Yes.
guaranteeing that tenants can get representation, legal representation, because it's also about preserving the livelihoods of people now as well, besides the building of new units. We've seen that in Jersey City too. Is like if in Portside Towers, if the tenants didn't organize, they could have gotten kicked out. Many of them, they could have, and they were able to then help other tenants. So the citizens, the residents, had to organize themselves in order to try to fight back when if there's no legal support. And I mean, as working people, maybe many times we don't even have time or the resources or the
Yeah.
connections to do something like that, so that to get the legal representation or even know our rights. So many times what I've seen in terms of displacement, I've seen friends from high school that their families have gotten pushed out by corporate landlords, by really making it unlivable, and them saying, and the landlords calculating, well, they'll leave eventually, I'll just take the fines, but at least they'll be out and I'll be able to charge whatever I want after. And so and again, that's not everybody.
Yeah.
There's mom and pops homeowners that they can that they should be protected and they should be supported. We have to also know that those scenarios do happen, and it's not as simple. And I've heard it from a landlord once, that he told me, I'll just pay them an amount of money, they can move somewhere else. Yeah, they will have to move out of their community, their church,
Yeah.
their friends, their family, their job. So because then they'll have to travel even longer. um, it's something that cannot be negotiated as simple as a commodity of saying, well, I'll buy a lower cost car instead of buying a more expensive car. That's where that type of mentality and economics goes out the window, because there is that human component, and that component of it's convenience, but it's also livelihood, and how I build a community over the years, and I want to be able to stick around in that community and elevate that community.
Exactly.
And people in communities that are supported and that are there longer, then become even stronger, more closely knit, look out for each other. So we need more of that.
Yeah. We need more tenants unions as well.
Yes. Yes. Yes.
Yes, to strengthen, and because tenants unions actually, there is a process to creating tenant unions. So I encourage everybody to look at, and learn about that, because that's a way to fight back the evictions. We don't have a lot of protections for tenants in the evictions laws. Is we have to do more improvement on that. So there's a lot to be done. And what I think that is important for a federal representative is that, like, we partner with the local governments and the municipalities to strengthen the ability for tenants to stay in their homes, because that's what they want to do, whether it be an apartment, through securing rent control, securing eviction, improving evictions process, providing legal counsel, but also, a lot of older families, older, are also losing their homes through evictions and predatory, buying of properties. And we also need to provide services for homeowners, like our older generation, who are also they go out and, convince them to sell, and then they just build apartments in top when they in those properties. So we also need to be able to protect homeowners, and Black women are actually having the highest rate of predatory lending and predatory mortgages and predatory evictions because of those practices. So we also need to figure out how to strengthen the ability of Black families and Black women to stay in their homes because they're losing them at a greater rate right now, and it is worrisome for the whole issue of wealth creation for Black families.
And you know, if the audience hasn't noticed yet, is or just to recap a bit is you have a PhD and you're so knowledgeable on all these issues. But it's not just about the academic accomplishments, but also that you've done work on the ground on these issues. You have spoken to the advocates. You have done your work, and you have a network not just statewide, but also nationally. I see you go to a conference in LA, you go to a conference in DC, and that's important. Is people seeing that that Patricia Campos Medina has been doing the work for a while from the ground, from
Yeah.
the grassroots.
As a labor advocate, the way I got into the housing crisis is because when we negotiate collective bargaining agreements of labor of what we call labor peace agreements, they're usually connected to development agreements that municipalities do with developers. You know, they purchase land or they zone land for redevelopment, and so we get in the front end of it. And what I learned a lot is that they do make these deals way back before people know that an agreement is already done as to how many apartments, how many homes, and they get all these tax breaks, right? So how I became involved is by proposing what we call community benefit agreements and redevelopment agreements with the states and cities. And this is something the New Jersey Housing Corporation knows a lot about how you need to be at the front end of development so that you actually create what's called community benefit agreements in which you actually spelled out to developers if you are to get a certain amount of tax breaks or pilots, you actually have to give back to the community by building affordable housing, how much investment in your schools, how much open space they're going to leave out. Those are things that can negotiate ahead of time. And that's why for me, all the issues that are connected to how you create livable communities have to do with how you create a place where workers, low-wage workers, can actually live, working people. So that's why I'm running. I mean, for me, running for office at this moment is so critical because I have been at the back end of how these deals get cut, and at the front end, nobody's talking about, well, it's 10 years from now that we're going to develop this house, we're going to develop all downtown Jersey City. And nobody thought about how we're going to build home. So, um, and when you said I know a lot, because I always came into any discussion about, okay, how are we creating opportunity for working people who had to get up and go to job and get a paycheck, how we are creating opportunity for them as we are envisioning an economy or we investing in an economy 10 years from now. And I think we need to do our politics that way. How are we enacting policies that are investing in people long term? And we need more people with my experience, I think, talking and seeing things that way. And that's what I decided finally, okay, I got to run for office. Now is the time for someone with my experience, from a woman like me that comes from the working class, the daughter of regular workers, a regular woman, a regular working woman. I still have a job. I teach at Cornell University. I commute to the New York City, twice a week. So I understand the difficulty of trying to get to work and the train is late or broken. It's not taking you to a place. So now is the time to send people like me who have come through the different places to actually advocate for working people in New Jersey. If we let career politicians, if we let Wall Street finance millionaires be the ones to go to Congress to make laws, we are going to get laws that benefits them. We need more people like me, regular people like you, to run again. I need secure run. Regular people like me who actually understand the difficulties of finding a home that I can afford, or paying rent, or paying my student loans. I spent 25 years paying student loans. So my car was always, the most affordable car because I had to still make my pay rent, and I had to live in Union City and pay $1,000 a month in rent in Union City by the time I got there. So you need someone with my experience to actually go to Washington, D.C. and say, okay, this is a proposed legislation. How does it impact regular people in New Jersey? And that's what I can do if you send me to the United States Senate.
And also, I mean, like the saying goes, right? If you're not at the table,
You're on the menu.
and also, if you're not at the table, bring a folding chair.
You're the folding chair.
So there's
Yeah.
there's a few sayings in terms of we need to be at the table as everyday people, and that's why I'm passionate about your race and the way that you're approaching it, and the why now. Why are you running now, and why are you? You summarize it so well. You mentioned public transit too.
Yes.
That's a big issue right now. And I was doing some math, and I was like, okay, so how much money, if depending on where your commute goes, that could be 1 or 2 meals that are taken away from you a week, if you will, just by the 15% increase that NJ Transit is trying to push forth. And as you mentioned, if we don't make the corporations who are benefiting from that economic development, from that mass transit systems, then we're not, they don't pay their fair share, then we cannot provide better systems and better life and quality of life for the commuters. And again, we're all commuters.
Yeah.
We just go to different jobs, but we all do some type of commute. And the only way to make traffic congestion less is by investing in more mass transit, because it's more convenient in terms of one, we hit less traffic, but also two, we're able to really get there on time. So what are your thoughts in terms of
The
that?
fallacy right now of the debate on funding New Jersey Transit is that there is this narrative that New Jersey Transit should be self-funded, that it should be able to pay for itself. But public transportation is a public good. That's what is public transportation, because there has to be a level of investment from the government to make it a good system in which people can get to and from work. So this idea that we need to raise fares so that New Jersey Transit can be operating itself, it will never. It is elected officials and I will say that our governor not taking responsibility for the fact that it is the role of government to provide public transportation and figure out how to fund it. Now, there are things that we could do. We can actually tax Amazon more. No, we have a billionaires tax that we got rid of, and there's a whole proposal to bring back the millionaires tax. We give so many incentives to Amazon to come and set up all the shops, all the redistribution centers that we have, all these corporations to move here. We're giving too many tax breaks. But how are people going to get to those jobs? If we were to tell Amazon, rather than take your ship to take that trip to the moon, actually give us that money to actually put it into the taxpayers here in New Jersey and actually fund New Jersey Transit so people can get to your job. Because if we do that, if we actually hold corporate America and tax them rather than give them tax breaks, we can actually invest in New Jersey Transit. Now, we also need to fight back to bring back most of our income taxes that we pay. New Jersey is called a payer state. We pay more taxes in our income than we get back. And we only get about 79 cents. I say if we were to fight for more money into New Jersey for a transportation trust fund, we actually could invest and upgrade New Jersey Transit and our rail. The problem is that the rail, right, is actually owned by Amtrak because we have not been able to build new rail lines. We actually need to build new rail lines. But a partnership between New Jersey and Amtrak and the federal government is important. I call it the artery of the economy in the East Coast. Everything goes through New Jersey. Wouldn't it be great if we were able to? Ocasio-Cortez has this dream that she has this video about how if we were to really invest in public transportation, we can upgrade our trains, and rather than take you 3 hours to get to Washington D.C. in an Amtrak, it could actually take you an hour if we're able to do what China is able to do and Japan is able to do. So we have a lot of work to do to invest in that infrastructure. And I know that President Biden was able to do some of those investments. Unfortunately, it's just to repair and to upgrade and maintain. We actually need to do way more than to just maintain. We need to like innovate. We need a new rail line, and we need to upgrade our trains.
And what something we it just reminded me also of our environmental justice issues that we have and how it impacts especially communities of color. I mean, we were fighting against gas burning, polluting power plant that New Jersey Transit was trying to do in Kearney,
Yeah.
and I wanted to see what are your thoughts in terms of because by building more train systems and better train systems, we're able to also improve
Our,
our carbon footprint, et cetera. So,
our air quality.
air quality?
Yeah.
What are your thoughts in terms of the environment and what we can do as in the U.S. Senate?
First of all, this whole debate about the congestion pricing, I think, is also misplaced. Right? If we were able to have more trains, people didn't need to drive in. But so we can fix one or the other and not say people don't want to pay to go into the city, but there's no other choices, right? So it's sort of like we had to fix one or the other. And getting people off their cars and moving them into mass transportation is a way to reduce our carbon footprint and to actually increase our air quality. Also, getting our distribution centers to actually move that cargo to train rather than to move it through trucks. That would also impact because all these neighborhoods are being impacted by the fact that we have not been able how to declog moving of the supply line in this area. So I'm all for figuring that out and trying to figure out how to get more resources to improve our transportation and our rail line. Now, another thing that we need to do, we need to actually build another tunnel so that we're able to, because all this expansion of the 78 or the corridor or the turnpike doesn't work unless you're actually able to build a new tunnel. And so I will be working really hard if I go to United States Senate to actually make sure that we get the resources to build a new tunnel to make it easier to get into the city.
And just to wrap up, when we think of the U.S. Senate race, could you tell us one, when is the primary election? Because this is for the Democratic primary in New Jersey. And two, what differentiates you? Why you? Why not your opponent, your Senate opponent at the Democratic side?
The election is June 4th. It's the Democratic primary. There will be a Republican primary. We don't talk about that one. We want Democrats to vote June 4th, and you can vote by mail, you can vote early, or you can vote in person, whichever you decide to do. Now, why me? Now is the time to send a working class champion, a woman, to the United States Senate. We are in the middle of high levels of economic insecurity, where workers, women, are demanding better working conditions and better wages and better salary. They're demanding more investment in child care, on after-school care, on home care. Those are priority issues that I have been working for 30 years. How do we make sure that women return to the workforce, but that we also invest in their children through child care and after-school care, in their lives through affordable health care and Medicare for all, and through support through their elder parents. We're the sandwich generation. We have children, we have grandparents who need care. So why now? Why me? Because it's about time. Now is the time to send a woman who understands the importance of women in the economy and supporting women so that we can be good mothers. We can defend our reproductive freedoms and defend our rights that are under attack, and that we can also be good daughters and take care of our parents who took care of us. So now is the time to send a woman to the United States Senate, and I am that woman. I am a labor champion, and that's why if you want somebody to fight for the issues that we wake up every morning to thinking about, you actually want to send someone like you, like who will fight for those issues and will wake up every morning and think, oh my God, how am I gonna get my kids to school? And how am I gonna make sure that they're supported and that they actually graduate on time? that's what I would be thinking about because that's what I think about every day.
Patricia Campos-Medina, what's your website? Where can people find you?
My website is patriciaforsenate.com, Patricia número 4, senate.com. And you can read all my platform. You can donate. I do. This is a grassroots campaign. I don't have the millions of my opponent, but I have small donors, and they are keeping me going. So donate whatever you can and sign up to volunteer.
Y en español también, rápido, nos puedes decir por qué estás corriendo para el Senado y también por qué tenemos que votar el 4 de junio por ti.
La elección es el 4 de junio para toda mi gente latina. Esta elección es importante porque este es un momento que tenemos una gran ansiedad económica en los trabajadores en Estados Unidos. Tenemos ataques en contra de la comunidad inmigrante. Tenemos falta de acceso de vivienda para nuestra comunidad latina aquí en Nueva Jersey y necesitamos a alguien que entienda esa realidad. Yo soy una mujer inmigrante, una mujer trabajadora, una mujer luchadora por los derechos de los trabajadores. Tengo 2 hijos, soy una madre, tengo mis padres que son ancianos. Todos los días tengo que preocuparme de ir a trabajar, de cuidar a mis hijos y de ayudar a mis padres. Y eso es tiempo de que enviemos a alguien al Senado de Estados Unidos que entienda las preocupaciones de las familias en Nueva Jersey, y esa seré yo. Ayúdenme a hacer historia. Soy la primera latina y la primera mujer que se lanza para representarlos a ustedes en el Senado de los Estados Unidos.
Y salvadoreña.
Y salvadoreña, centroamericana, que también es algo histórico.
Excelente. Patricia Campos-Medina, thank you so much for joining us in the podcast, the Change Podcast. And everyone, don't forget to subscribe to our channel, and you can find me on all platforms as Ron Bautista NJ, and you can check out my website, ronbautistanj.com. Thank you so much, Patricia.
Muchísimas gracias.
Gracias.